World Health Organization leaders are preparing to discuss COVID today. The pandemic has entered its third year after cases started spreading in China back in 2019. WHO officials originally declared COVID to be a pandemic on March 11th, and now they'll update the world on whether the virus still presents a global emergency.
Infectious disease expert from the UNC School of Medicine, Dr. David Wohl, joining us on what we could expect to hear and the future of the pandemic. Dr. Wohl, nice to have you back on the show. Good morning.
Good morning. Good to be back.
So we know this WHO meeting is happening later today. Your advice, I mean, what do you think about COVID? Certainly where we've been, but where we are now, is it still considered an emergency? What do you think?
Right. So some of this is terminology that the WHO uses to help alert us to what's going on and also to mobilize resources to confront whatever crisis is happening. So I think we know we can't be in an emergency posture indefinitely. And the pandemic is different today than it was when we first started to deal with COVID-19 and even a year ago. We've built up more immunity. More people have been vaccinated. A lot of people have been infected with Omicron, the latest variant, that seems to protect us against some of the subvariants. So I think we're in different territory. Is it over? It's far from over. As anyone who's been sick, as anyone who's been hospitalized recently knows, this is not gone, but it is in a different phase. And it's one of those things that we're going to have to live with for quite a while, for the foreseeable future.
Doctor, if they decide to remove the title of having it be a pandemic, what does that do in terms of changing things? Does that limit access to materials, to ability to get emergency use authorization? What does that look like?
No, not so much for the WHO. I think much more importantly is domestically. The signaling that we get and how we classify the pandemic. And again, it's very hard. We're in territory we haven't been at before. This is a very unusual sort of situation. Look, we've been through other outbreaks before that have been massive. HIV, for instance, which is a pandemic, but it's something that has gone on now for decades. We certainly don't react to it now like we did in the early years when HIV was spreading across the world and we didn't have effective medicines and we still don't have a vaccine. So I think that we're in a different phase. I don't think it means much for us in our day-to-day dealings with COVID-19 here in the United States. In other parts of the world, it could make differences for resource allocation. Here in the US, we've taken a posture, I think, that you've started to see of how do we go forward living with this virus. And just yesterday, the FDA, as you know, had an advisory committee get together and even think about something like annual vaccines against COVID-19 for the population here in the U.S.
So would this sort of fall in line the way we do flu shots? Every year we go back for flu shots. We would basically do the same for COVID shots?
Exactly. So the idea here is how do we, A, simplify the process of COVID-19 vaccination? Right now, there's been a mix. You get 2 shots or 1 shot, depending upon which vaccine you get, how often you get a booster, which booster do you get. We now have a bivalent vaccine that covers really well the newer variants that we have, better than the original vaccine. So the vaccine that we have right now, this bivalent, is very effective at preventing us from getting sick enough to get hospitalized, preventing us from needing oxygen. It's not as good as we need to prevent infection. But given what we've got, certainly older people getting vaccinated on a regular basis makes a lot of sense. I think what the FDA and the CDC are going to have to decide is what about younger people, people who aren't at high risk for getting hospitalized? Do they really need an annual vaccine? I think we're leaning, many of us, towards older people, 65 and above, a vaccine at least once a year, and younger people making it more optional.
Doctor, I do want to ask you if they take into account public perception in any of this. I know that we have to base it on the numbers and access to materials and things like that, but if the WHO comes out today and says, okay, the pandemic is over, is there a fear that some people say, okay, we're in the clear? Yeah, we're done.
Yeah, I don't think the WHO will ever say that the pandemic is over with the kind of case numbers that we're still having. People are still dying from COVID-19. Remember, we also have long COVID, and we're seeing more and more data about this as time goes on. There's a lot of folks out of work right now with long COVID, a lot of people with disability due to long COVID. And you can't get long COVID unless you get COVID. So we're not going to say the pandemic's over. Anybody who's educated and thoughtful about this. We are entering into a different phase, as we know, where the virus is more quote unquote endemic. It's going to be here. It's staying here, just like influenza's here. The difference with COVID is that we'll have surges. It won't be seasonal. We have it all year round. So how do we take the tools that we have available to us right now, including the vaccines that we have, and use it strategically? And not only that, but use it in a way, as you said, that people can understand and accept. I think an annual vaccine strategy makes some sense given the tools. But what we really need are even better tools, right? We need vaccines that can protect us 95% efficacy, like we saw with the original vaccines. We need maybe a vaccine that could be administered intranasally, that you squirt up your nose. That would be easier to take 2 or 3 times a year, or even annually, than a shot. So those are the things we need. Congress has to allocate funding to help make that happen. And there hasn't been any new congressional reallocation for COVID-19 funding. So that's another thing that I think we need to do. The tools we have now are limited. Given the limitations, annual vaccine, especially for older people, people who are more immunocompromised or at risk, seems to make a lot of sense to us and is simple and acceptable. But the pandemic is not over.
Dr. David Wohl, infectious disease specialist. We will be listening to that WHO meeting later today to see what they say about the pandemic. Thanks for your time today and bringing some really good points. We appreciate it.
Absolutely. Thank you.